So we're back again. Jay Gray is here from the Gravedigger Report. I have a special guest by the name of Dr. Jody Adewale, University of Southern California, clinical psychologist. We're going to go in depth and talk about the student athlete related to behavioral health and also substance abuse and also some other factors related to the mental health field. Doc, what's going on, sir? How's everything?
Hey, everything's good. I appreciate you having me. It's such a very important topic, talking about the mental health, especially for young adults. That's an important transition going from teenage life to adult life, and I'd love to explore it with you.
Definitely. So, Doc, give us a little bit of history about yourself. We know that you played at University of Southern California. We know that you're a clinical psychologist, but we know that you actually were on the football field. And here on the Gravedigger Report, we actually interview athletes based on touchdowns, sacks, all the other great things. But we want to go more in depth related to the behavioral health. And we know that you being a former athlete, played at that high level at University of Southern California, along with myself. We want to know a little bit about it for the listener, viewers, and followers.
Yeah. So a little bit about me. Born and raised in LA, Boyle Heights. Grew up in the projects there in East LA. Got a football scholarship to SC, and my first 2 weeks there, I realized I need to go to class, man. I need to get this education.
Right.
I was supposed to be a running back, but my running back class was Lindell White, Chauncey Washington, Reggie Bush, and I got moved to fullback. And real quick, I had the realization that football is going to only take me so far. Right. So I got the bachelor's in psychology there, then the master's in marriage and family therapy, and then I moved to San Diego and got the doctorate in clinical psychology. So I've been practicing for few years now. I have a private practice. It's Adewale Psychological Services, and we see, athletes, we see adults with mental health challenges, we see teenagers and kids too. I'm also a professor of psychology at East Los Angeles College, where I teach neuropsych, developmental, clinical, and social psychology courses, as well as introduction to psychology. But sports has always been, I feel like sports was like a savior for me. Growing up in the hood, sports helped keep my nose clean and keep me out of trouble, but also gave me that stepping stone to move to the next level. And I think when it comes to sports, it can be that thing that uplifts you, but it also could be that thing that's a monkey on your back. The identity that the athlete holds, the way the athlete copes with the stressors of the sport. So I'd love to get into it with you.
Definitely. So while you were at University of California, did you ever think that, you would be this individual? And the reason why, because we're going to circle back to this question at the end. Mm-hmm. When we play sports and, as of right now, it's October, mid-October, football is at its all-time high, homecoming week, for some schools. We know that athletes are at a place where they're like, hey, if the team is doing good, I'm doing good. But in all reality, are you really doing good? And this is from a behavioral health standpoint. And can you shed a little bit of light on that, from your clinical work that you have done?
Yeah. So I'm going to start off with identity. We figure out who we are. A big part of our identity is developed in our teenage years, from about 13 to about 18. And for an athlete, usually they're playing, maybe Pop Warner, but usually they're playing in their high school, or their teenage years. Right. And that gets wrapped up into who they are. This is who I am. Ask any adult, tell me about yourself. They're going to say, oh, I'm a lawyer, I'm a teacher, I'm a cop. What they do is wrapped up into who they are. And if what they're doing, if it's going right, and if things are going good, they feel good. But if it's not going well, then their sense of self, their self-worth takes a hit. And for a lot of athletes who might not be starting or might not be playing the position they want, or their team is losing, that can take a hit on their mental health. You might notice anxiety. You might notice symptoms of depression. You might notice this general angst that's there where where it feels uncomfortable just being in their own skin. So for a lot of athletes, their sense of self is tied into the success of something that's somewhat out of their control, especially if you're in a team sport. You can't control who's blocking who. You can't control where the receiver runs their routes. So some advice I give to adults and athletes is, you are not 100% what you do. What you do is a part of you, but you need to have what we call this internal locus of control. So in psychology, there's an internal locus and an external locus of control. Internal means I'm in control of what I feel. I'm in control of my destiny. I'm in control of what I do. Sports flies in the face of that because there's so much outside of your control, and a lot of athletes struggle with this external locus of control. Something else is in charge of how I feel. Something else is in charge of my success. Coaches will teach you all the time, you're the master of your own destiny, which is important. But in the grand scheme of things, their emotional state isn't always 100% in their control because of the importance sports plays in their lives. Yeah.
So would you say that for athletes that are playing as of right now, they are feeding off the win, and also they are stating like, hey, this win will also give me the high that I need, or the feeling of, of a self-esteem that is very at an optimal level to push through the week?
Yeah. You'll see that, and that's a tricky place to be in, because I talk to a lot of athletes who are they're in the civilian world, they're no longer athletes, and then a lot of them talk about they're searching for that high. They never feel as high as they did winning the game or making that tackle or dunking on somebody, and it's good to get that feeling of success and of the win, but making sure it plays a role in your life that's healthy, and that's not your only source of joy. That's not your only source of pleasure. You need to have other aspects in your life where you're feeling, a sense of mastery or a sense of joy. It could be something simple as barbecuing. I get a high from barbecuing. I get a high from gardening or, baking with my partner. When your only source of joy is tied up into one thing, that puts you at risk for, potential dissatisfaction with other areas in your life.
Right. Now, as far as for an athlete, where can they receive some of the resources on campus? And this is based on performance anxiety. This is also based on social anxiety as well, too, Doc, because you might have an athlete that's kind of like, hey, I wasn't starting, but now I got in the game. I won the game from a touchdown or from a sack. Now I have a lot of individuals that want to interview me. I have a lot of individuals that want to get to know me a little bit more. I have anxiety. I'm not used to the spotlight. I'm not used to being up front. Or it could be on the back end. How can an athlete receive resources while they're on a college campus?
Yeah. So there's many different ways. The easiest, just the cut and dry way, is every college has a counseling center. Okay. And I would assume most athletes have the access to the counseling center. If there's like maybe a $5-10 copay, I don't know, but every athlete has a counseling center. And I would suggest every athlete listen to this, at least look at your counseling center's website, maybe go in, just shake hands and meet someone, just to know that resource is there. There's sports psychologists, especially in these D1 or big schools. There's always going to be one or two sports psychologists there. And the thought is, sports psychologists are going to help me with my performance. That's one part of sports psychology. But another part of sports psychology is dealing with athletes who have clinical problems, depression, substance use issues, anxiety. They might be having some problems with managing their academics, with attention. So the counseling center is there. If you want to go somewhere outside of your school, if you have health insurance, if you flip the card around on the back of your health insurance, there's a phone number, and you can call them and ask for a list of therapists in your area with this specialty, and they'll send you a list. A really good website is Psychology Today, psychologytoday.com. You literally just type in your zip code, and you can filter it for people to take your insurance, people that are a certain ethnicity, a certain gender, and work on a specific topic, and it'll show you all the providers in that area. But one thing I don't want to push is therapy isn't the only answer. If you're dealing with a struggle, that's a really good tool. But if you're averse to speaking to a mental health professional, talking to your coach about what you're feeling, talking to your other teammates, talking to someone, if it's a neighbor, not bottling it up. There's a common reaction for a lot of athletes where they're struggling with something. They're taught to suck it up, put your head down, and just keep going. That's important for some things, but when it comes to mental health challenges, talking about it with other people, connecting with other people about it. We have this tendency to isolate, especially when we're struggling. And we feel like we're alone in the world, and fight against that urge and speak to someone about it, about what you're feeling. You don't have to tell the world, but someone that's trusted, talk to them about what you're feeling, and then see where you go from there.
Exactly. Now, Doc, as far as for some of the symptoms, that an athlete might encounter, especially as of right now, mid-October, football season, when should an athlete seek this service as far as for counseling and follow up, for therapy and follow up for even medication management if needed? What are some of the signs and symptoms that an athlete can identify by him or herself and say, you know what, I need to go and seek some attention?
Yeah. So there's the symptoms. There's different symptoms for different issues, but a real good way I like to look at it is checking in on your physical body. I'm talking about like you get injured from a sport. That's different. Checking on your physical body to see if there's any changes in my physical body that are giving me a sign that I need some help. Is my heart racing? Am I sweating? Am I agitated? Am I jittery? Is there unexplained pain somewhere in my body? Am I getting sick often? And am I constantly getting sick? Checking your physical body, checking in on your emotions. How am I feeling? Is there any sadness? Is there any anger? Is there any irritability there? Is there any panic going on with my emotions? Third, checking on your thinking, your cognitions. Am I sort of focusing only on negative, or am I having trouble remembering things? Am I just having this trouble concentrating, or this just general memory fog? One common reaction to people who are struggling with some type of mental health challenge is their only focus goes to negativity. They only see risk. They only see problems. There's this just cynical perspective. So your physical body, your emotions, your thinking, and then checking on your behaviors. How am I acting? Am I lashing out at other people? Am I isolating from other people? Am I overworking? In sports, the coaches want you to study film. They want you to go, work out hard. But am I taking on more than I know I should? And am I starting to get burnt out? So if you can check in on your physical body, your thinking, your emotions, and your behavior, all of this is the way your body gives you information. Your body and your brain are sending you information all day, and the signals are coming from my thinking, my behavior, my emotions, my physical body. If we don't listen to those, the signals get louder and louder until we pay attention. So I'd encourage anyone to check in on those daily, see how I'm doing. And if you notice 2, 3, 4 of those symptoms that are present for 2 weeks, that might be a sign that I might need to reach out for help. Also, changes in your sleep, changes in your appetite, changes in sort of the relationships you're having. These are all things to look out for, and start asking for help instead of waiting till things get too unmanageable. Last thing, one common reaction I've seen for a lot of patients who reach out to me is they reach out in crisis. Things have got so unmanageable, they don't know what to do. And if they would have reached out 2 weeks, 3 weeks ahead of time, this crisis would have been averted. So don't wait. If you feel like it could be beneficial, go for it.
Exactly. Now, Doc, can you paint a picture as far as the athlete having a conversation with a coach? Give you a prime example, case study. If you have an athlete that is going through a episode and they had, distribute, some behavioral health symptoms throughout the course, what does that conversation look like talking to a coach during midseason and going to the coach's office and saying, hey, coach, this is how I feel. This is what's been going on. I know I've been performing great on the field. I know I'm that All-American. However, this is how I've been feeling inside. How should this individual, whether male or female, how should they have this conversation with the coach?
Yeah. So just some structural side to it. I wouldn't do it like when there's a lot of people around. I wouldn't do it Monday morning first thing, or Friday, when everyone's leaving. Making sure you have time for the conversation and the coach has time for the conversation. I would actually try to schedule, hey, can we schedule a time, 30 minutes, you and I? Can we schedule a time? So there's space for it instead of it feeling rushed. But it sounds hard. I mean, it sounds simple, but it can be hard to talk about your feelings, to talk about, what's going on with you. If you have a trusted coach or someone in that athletic department that's trusted, they might not be able to relate to your specific mental health challenges, but everyone can relate to stress. So if you're struggling, talking about what's going on with you, you can talk about stress. Hey, I've been really stressed out these past couple of days, or this is how stress is manifesting in my life. I've noticed changes in my sleep. Right. Being open and honest as much as you can, as much as you feel safe. So I'll give you an example. Let's say I'm struggling with anxiety. I have this performance anxiety. Right. I go to the coach's office. Hey, do you have time to talk? Coach, I don't know what's going on with me, but I've been feeling different lately and I'm struggling. And I was wondering, can we talk about it? Is there any support you can offer? Also, in the athlete's mind that's approaching this coach, I'd encourage them to be realistic. The coach isn't a trained mental health professional. It's not a psychiatrist.
Exactly.
They're a coach. And more than likely, they're going to say, I understand, I'm here to support you. Keep pushing. You got this. The encouragement is what you're going to get,
Right.
And so look to them as support, but they're not trained to be a clinician. So maybe asking them, what's your thoughts on seeing the sports psychologist here? Most coaches, if you present that to them, should respond with, hey, we have a sports psychologist. That's something you should look into. But also there's most colleges have this student athlete academic services. At USC, they call it SAAS.
Yeah.
Most of those people in the academic services side are well trained with mental health issues, at least at minimum to point you in the right direction. So if you don't feel that vibe from the coach, you can go to someone in the academic side and that can provide some of that support.
Noted. Now, say if we have an athlete that is a star, and we both had, at University of California, we played with stars. How can an athlete manage the load as far as load management, along with the stress, along with the anxiety, along with, other symptoms that might cause a conflict related to behavioral health? How can load management take place? Because it seems for us within the workplace, we wake up sometimes and we have this saying, especially coming out of COVID, hey, I'm going to take a mental health day. Yeah. Athletes, I don't know as of right now, are able to go to practice and say, you know what, I'm going to take a mental health day, coach. Especially a D lineman or, a Heisman quarterback or, a running back. Yeah. But I know they want to take a mental health day.
Yeah.
So how does that look?
Yeah, just quick sidebar. I don't think that's even an option for athletes taking a mental health day. I mean, unless things are real severe, but it's needed. I can remember walking to practice one time, crossing the street, and I was so drained and I didn't want to go to practice, and I was like, I just can't deal with it. I wish I got hit by a car right now. Like that was my thought process, literally like hoping someone hits me just so I don't have to go to practice today, because that's how stressed I was. And for the reality is you have to go to practice. You have to do these requirements, part to keep your scholarship, to play, also for your career. But boundaries are really important. Right. It's about boundaries is like this umbrella term. And underneath boundaries, there's emotional boundaries. I'm able to feel what I want. You can feel what you want. There's intellectual boundaries. I can think what I want. You can think what you want. There's time boundaries. People shouldn't be draining all hours of the day from you. Then there's financial boundaries and obviously physical, sexual boundaries. People shouldn't touch you without your permission. If you have to give your life over to your sport, in your personal life, ask yourself, where do I need to start strengthening my boundaries? Where am I draining? Where are people draining my time and my energy? Also in the sport, do I need to set up better emotional boundaries with the coach, with other athletes? Do I need to set up emotional boundaries with myself in a sense, not making the sport more in my head than it is in reality? Exactly. That's one thing. Boundaries are essential for, our own mental health. Also to finding balance, boundaries and balance. Balance is